Hello and welcome to the Life Enchanted podcast. We're on a mission to optimize our lives through faith, health, wisdom, and much more. Thank you for joining us on our journey. Here now is our host, Nick Carlisle.
What is good, ladies and gentlemen, and welcome to the Life Enchanted podcast, where it is my duty to explore all things related to living an optimized and fulfilling life. I personally am on the never-ending journey to improve myself and figured why not share my findings and my conversations with as many people as possible. This episode is brought to you by mylifeenchanted.com, which is where you can find all things related to the Life Enchanted movement. You can sign up for my email newsletter on there, read my blog, check out some apparel I designed, and a bunch of other stuff as well. Also, I would love to keep this podcast relatively sponsor-free, and to do that, I need your support through Patreon. You can visit the support tab on my website to learn more about that. Your contributions through Patreon will keep the Life Enchanted content flowing and will also help me dedicate more time to expanding the content, i.e. the blog and newsletter and whatnot. But most importantly, a portion of every cent that comes through Patreon and my online store will be donated to Metro World Child. You can find out more about them through my website on that support tab. Also, please consider leaving a rating and possibly a review of the podcast on whatever platform you're using. Your feedback helps other people discover the show and join the movement. Today's guest is licensed clinical psychologist, assistant professor, researcher, and published author Dr. Robyn Gobin. We talk trauma, self-care, mindfulness-based stress reduction, otherwise known as MBSR, and a lot more. It was a pleasure for me to talk with her, and I am stoked for you guys to hear this one. So without further ado, Dr. Robyn Gobin, ladies and gentlemen. All right, Robyn, thanks so much for doing this.
Yes, thanks for having me.
So I thought we could start with trauma because I saw a statistic that 70% of people worldwide have experienced some type of trauma in their life. So what is your definition of trauma?
Yeah, so when I think about trauma, I think about any event or experience where your capacity to cope has been kind of like taxed or overwhelmed to the point that you don't have the resources to cope with that experience. And oftentimes what comes with trauma is a threat to your life. So there's some kind of extreme fear or extreme threat to your life where your ability to cope is the stressor or the trauma kind of like goes beyond your ability to cope. And so there's a lot of concerns about whether you're going to lose your life. And so there's tons of types of traumas. The type of trauma that I work with most is what I call interpersonal trauma, which is a trauma that another person perpetrates towards you. So it could be a physical assault, it could be sexual assault, domestic violence, some kind of kidnapping or torture. That's the type of trauma that I deal with most of my clinical practice and in my research. And what I find with those types of trauma is that there's kind of like this extra layer of challenge that the survivor has in trying to heal from that, because not only were they traumatized and their coping mechanisms were overwhelmed during that experience, but also it was perpetrated by someone who often they believed was supposed to be able to be trustworthy, or someone who they wouldn't expect to do that to them, because oftentimes when we experience interpersonal trauma, unfortunately, it's someone who we know, we're familiar with. So when we have relationships with people, we expect that they are going to look out for our best interests and that they're not going to do us any harm. And so what happens with those types of traumas, what we call betrayal trauma, is that, you know, your trust has been betrayed. So it shatters all of your assumptions about how relationships are supposed to work and how the world is supposed to work. And so there's this extra layer of healing that has to be done when survivors have to kind of try to make sense of what happened to me, why did this happen to me, and how do I move forward and have healthy relationships.
Yeah. Is there So those are kind of extreme cases of trauma, which I totally get. Are there some more subtle cases of trauma that you've seen as well? Like that people maybe, because I feel like those cases of trauma people can kind of recognize, like this, like when he beat me, or when, you know, whatever happened, I got kidnapped or whatever it is, those things, you know, those clearly have a bad impact on my life, or negative impact on my life. Are there more subtle things that you see as well, where people are like, oh, I didn't even think about that, but that is totally impacting the way I view the world?
Yeah, I mean, I think experiences that, I mean, unfortunately, those things that I listed are very common. They
Mm-hmm.
may sound extreme, but they're unfortunately very common. But some of the ones that we don't talk a lot about are more of the kind of verbal abuse and emotional abuse that sometimes people experience. So, kind of always being manipulated or being talked down to, or told that your emotions are out of whack, or that you're overreacting. That can be certainly kind of be an experience that has
Mm.
that's abusive, and that has an impact on the person, especially over time, if they continue to have that experience over and over again.
Mm-hmm. What are some ways that you walk your clients through identifying their traumas? Is it just kind of like hearing their stories, or how do you kind of get down to the foundation of what's causing these issues?
Yeah, so a lot of times it's just a matter of asking about it. A lot of times it's important when you're, meeting a new client for the first time to get a comprehensive sense of their background and the experiences that they've had. And what I find particularly important is sometimes not to call things trauma, because a lot of times people are experiencing things that me as a professional would label as traumatic, but they don't necessarily consider it traumatic, or they just don't have the language or the understanding of what trauma is to be able to say, like, oh, my experience would fit in the category of a trauma. So
Mm.
what I try to do is just ask more descriptive questions about, like, have you ever had an experience where someone, forced you to do something against your will, or something you were uncomfortable with, and things like that, so that then I can kind of get a sense of the level of experience that they've had of trauma, and then we kind of talk about, does that impact you now, and how does that show up for you in your day-to-day life? How does it impact your functioning at work, your the way that you think about yourself, how you behave in relationships, and then I'm able to get a sense of how it's impacting their life, and whether that kind of maps on to some of the symptoms that we commonly see with post-traumatic stress disorder or other mental health challenges that people face in the aftermath of trauma. So I use a lot of descriptive language and kind of try to stay away from terminology which may not fit for everyone,
Mm-hmm.
and then take it from there.
What are some of those common symptoms that you see from PTSD? Because I think a lot of people they associate PTSD with just like war, and they
Yeah,
don't realize that they have it. Um,
exactly.
yeah, and even I meet with a therapist once a week, and he's fantastic. He's been on the podcast before, but and in a recent session, he said, "I think you might have a little PTSD," and I mean,
Mm-hmm.
I'm non-military and
Mm-hmm.
haven't, I was raised very well in a loving family, have a wonderful marriage and stuff. So it was
Mm-hmm.
just like kind of shocking to hear that. So we're gonna dive further deep into that, but I feel like people they don't they don't think that they have the capacity to have PTSD because they weren't in these, they weren't in firefights and stuff like that. So what are some common symptoms that you see that kind of signal, oh, this person has some PTSD with their past?
Yeah, I'm so glad that you brought that up, because a lot of times we do, I think, just because the news that we get, it typically comes up around military and veterans. And so people think that, oh, that's a disorder that's only designated for that population, when that couldn't be further from the truth. So anyone who's been exposed to trauma could potentially experience and develop PTSD, although we know that some traumas are have more of an increased risk for developing PTSD. Any trauma could help you develop PTSD, but
Mm-hmm.
those symptoms that we commonly see with folks who have PTSD include one of the big ones is avoidance. So a lot of times people who've experienced a trauma avoid reminders of the trauma. So for instance, if a trauma can be like a car accident. So if I had a car accident and now I avoid riding in cars, so I will go out of my way to ride my bike to work, even when the temperature is 10 degrees outside.
Yeah.
So I'm willing to kind of go to extreme measures to avoid this trigger or this reminder of that car accident. That would be an example of a PTSD symptom, this kind of severe avoidance, and also avoiding talking about the trauma. So a lot of times people avoid thinking about it, avoid talking about it, and avoid going places or interacting with objects that remind them of the trauma. Another symptom that we commonly see is kind of having what we call intrusive memories or thoughts about the trauma. So during your day, when you're just going along, maybe something triggers you and you just have this intrusive memory of the trauma as if it's like happening again. So a very vivid remembering of what happened to you. And that also can happen during sleep, which a lot of people kind of describe as having nightmares, either about the specific traumatic experience, or the nightmare can be around a theme that was related to the trauma. So for example, a theme of not feeling safe, or a theme of, being in trouble, or someone being after you. So that can, and those nightmares are kind of really repetitive and very extreme and very intense and cause a lot of distress. Another symptom that we commonly see is this kind of exaggerated startle response. So very kind of feeling on edge and a lot of concern for one's safety. So never really feeling safe, never really feeling okay, and always kind of like monitoring the environment to look for signs that you're not safe or signs of threat or danger. And then another piece that comes with PTSD is changing the way that you think about yourself or the way that you look at the world. So a lot of times people may think more negatively about themselves, or they may start to develop more negative attributions about the world. So kind of looking at the world as an unsafe place, or a very unpredictable place. Maybe looking at themselves as blameworthy for the trauma. That's a big piece with trauma. A lot of times, especially with interpersonal trauma, people are trying to make sense of, why did this happen to me? And sometimes the conclusion that they end up drawing is that, well, I must have done something that caused this to happen to me, or that made me be a target for this trauma. And a lot of the work that I do in therapy really is trying to help people understand the importance of placing the blame accurately on the perpetrator of the trauma, because that creates a lot of distress when people have convinced themselves that they somehow are to blame or are responsible for the trauma that they experience, which is I would say 99% of the time not, or even 100% of the time not the case. They did not, no matter what they were wearing or what they said or what they did, they still are not to blame for what they've experienced as far as trauma.
There's so much there.
Mm-hmm.
Yeah, that's very helpful though, and I think that those a lot of people could probably relate with a lot of what you said there. What do you think that it's oftentimes subconscious, that people aren't really realizing these effects, like when they're not talking about it, they're avoiding talking about it because it's almost just this subconscious feeling or power that's not allowing them to, they're not even actualizing it or realizing that that's occurring, or they're avoiding
Yeah.
situations subconsciously? Or do you think it's more like I'm actively not going to do this because I remember what happened last time?
Yeah, I think it can be a mixture, but I know that the mind remembers trauma and holds memories. So sometimes people will talk about like just not really thinking that they're doing something intentionally, like avoiding something intentionally. Or a great example is the anniversary of traumas will come around. So, maybe you got in a car accident a year ago in August, and now August is rolling around, and you start to notice that you're more anxious than you typically are, or
Yeah.
you're starting to have more nightmares. And so that's that. In that way, that's more of the subconscious, like the body kind of is remembering and tracking and trying to kind of keep you safe. And so sometimes that is an unconscious thing that the body just kind of like does automatically, kind of like how we breathe automatically without any intention or effort.
That's so
The body
weird.
sometimes, like just tries to protect you, and so kind
Mm-hmm.
of can sometimes consolidate memories or keep things out of your conscious awareness. And that really is a survival mechanism so that you can go on throughout your life and function through your day. So a
Mm-hmm.
big thing with sometimes people who've experienced abuse early on in their life, maybe in childhood, is that sometimes they don't have memories or specific details around what happened to them, but as they get older, sometimes those memories start to come back to them, or they start to have experiences or triggers that kind of remind them or give them kind of brief glimpses into what they've experienced since the childhood, and then they are able to process that in therapy.
Yeah. Yeah, that subconscious timing and the body's ability to kind of signal that is
Mhm.
crazy. And
Mhm.
when I was talking with my therapist, that's kind of something that we identified, because I've been talking with him about midday. I typically get like this feeling, like between like 12 and 1, or like 1 and
Mhm.
2, I get this feeling where I'm just more anxious, my body temperature
Mhm.
increases. I've mentioned this before on the podcast, but it's just weird that it happens often.
Mhm.
And I've tried messing with my diet, I've tried messing with caffeine intake, I've tried messing with, hydration levels or
Mhm.
whatever it is. And he, after a year of seeing him, he's like, man, what has happened at this time in your
Mhm.
past? And that's where he started
Mhm.
to bring up the PTSD, and we've only kind of
Mhm.
scratched the surface. And it's like, we haven't identified anything yet, but it's like,
Right.
oh, that's super interesting. I
Mhm.
wonder if there is something there where my body is just kind of telling me, like, oh, it's 1 o'clock, it's 2 o'clock again. Like, this is what happened that one time. Let's prepare
Mhm.
for it.
Exactly.
So I'm
Yeah. Yeah.
interested to see.
The human body is amazingly resilient in that way, how it protects us, even during traumatic experiences, how it kind of shuts down the unnecessary functions in the body and really kind of gets hyper focused on that fight or flight.
Yeah. Yeah, it's amazing. So this is going to be kind of a loaded question, but what are some ways that you've found to be helpful for your patients to overcome some past traumas? And you can speak generally.
hmm Yeah, so I tend to do a lot of work around, first of all, just building a sense of a safety, building a great relationship. I think early on as a therapist, I kind of thought that people who've experienced trauma would come to me and just be ready and jumping at the bit to process their trauma, but oftentimes that's not the case. It's really important to develop a strong, nurturing relationship with them where they can kind of feel safe with me, particularly since I work with folks who have been harmed by people, maybe in their family or people who they had previous relationships with, people
Mm-hmm.
who they should have been able to trust or did trust, but that trust was betrayed. So that makes it even more important that I kind of don't just have this expectation that just because I'm a therapist that they should trust me, but that I kind of put my time in, if you will, to really earn their trust and build a relationship with them so
Mm-hmm.
that then they get to a place where they feel comfortable talking about the details of the trauma that they've experienced. And then we can delve deeper into helping them kind of process and talk about the trauma. So one of the main things that we do is kind of like in order to help heal from the trauma, you have to be willing to kind of go through it and talk about it, if you
Mm-hmm.
will, and share the details so that you can process it in a different way and store those memories differently. So a lot of that is talking about the trauma, the details of the trauma, and trying to make different different a sense of why it happened to you again, like trying to explore some of that shame, some of the blame that people have placed on themselves for the trauma, like exploring that and getting deeper into that and helping them potentially look at that from a different lens or a different perspective. Um, and then a lot of my work with trauma survivors is really helping them to see that they exist beyond their trauma and that they are larger than this traumatic experience that they've had. And so once we've processed the trauma and worked through it and they've experienced some relief from their symptoms, like now who do you want to be in your life and how do you want to move forward? That's really important to me because a lot of times trauma survivors, rightfully so, like the trauma has just taken up so much of their mental energy because it's a lot to manage all of those symptoms that I shared a few moments ago. Like that takes a lot of mental energy, and to try to do just activities of daily living like work or take care of kids, take care of a household.
Yeah.
So once they can kind of unload some of that mental energy from managing the symptoms, then it's like, okay, what do you want your life to be about? What is most meaningful to you, and how can we kind of build a life that is worth living and that allows you to have really constructive and fulfilling relationships again, even though in the past your relationships haven't been what you deserved. So really kind of looking at that kind of broader life perspective, like what gives your life meaning, and then helping people to build the life that they want for themselves.
Yeah. Do you try and, after they talk through it and whatnot and identify it and process it, do you try and have them as part of that whole developing the meaning in the bigger picture and changing the perspective? Do you try and have them label that trauma in a specific way, like, wear it as a badge, or wear it, like it's a piece of my past that shaped my resilience, or something like that? Do you try and stick a label on it?
I wouldn't say necessarily a label, but I do want my clients to have an understanding that they exist beyond their trauma, that they are not their trauma. So that's really important to me. So if that is a label, then yeah, I want them to know that and kind of carry that around with them, that I am larger than this one experience that I have had, and this one experience does not define me. Yes, it's a part of my story and it's a part of my history, and it's something that will never go away. Like, unfortunately, they can never kind of go back to the person that they were before the trauma happened, because they'll always have that memory with them that I think forever changes them, and that experience that will forever be with them. But that doesn't mean that they can't experience happiness, joy, and fulfillment again. And kind of and try to understand, like, how did experiencing this trauma kind of affect me in ways that made me maybe stronger, or helped me to kind of see capabilities that I didn't think that I had before, and how can they kind of, for lack of a better word, like turn lemon into lemonade, and kind of like allow the trauma to work for them in their lives. And again, the main piece is just not having the trauma take up so much of their mental energy and their time, so that they really are enjoying the life that they have and finding meaning and purpose in their life.
Yeah. I read that MBSR, mindfulness-based stress reduction, is part of your practice.
Yes.
What exactly is that? Because I'm somewhat familiar with it, but I'm sure numerous people aren't. But what exactly is MBSR?
Yes, so mindfulness-based stress reduction is a intervention that was developed by John Kabat-Zinn in Massachusetts, and it really was developed at the start for folks in medical facilities who had pain, and they were having difficulties managing that pain. So it really is an intervention that uses mindfulness and the practice of meditation, which commonly is just being in the present moment. Often we connect to the present moment by connecting to the physical sensations of the body as it breathes. So that's what we're doing when we're practicing meditation, is observing the breath, becoming aware of the breath. But it's not just a concentration practice. It is kind of focusing on one thing, so it helps you to narrow in on that. But it's also a particular quality that you pay attention with. So in addition to being in the present moment and paying attention to one thing at a time, you're doing it, first of all, non-judgmentally.
Mm-hmm.
So you're not necessarily labeling your experience as good or bad, or judging yourself if your mind wanders during your practice, but rather you are accepting what happens in each moment, and in being very curious about what is showing up in each moment as you're sitting there, paying attention to your breath and really tuning into those physical sensations of your breath. So it's a practice of learning how to use mindfulness and meditation to better manage stress in your life. And so during the curriculum of the mindfulness-based stress reduction, again, you learn meditation, you learn mindfulness, but you also learn some mindful movement, so a light version of yoga. So to learn how to be in the body, because a lot of times we are, of course, in our bodies all the time, but we rarely are intentionally in our bodies and it's intentionally paying attention to what our body feels like. And so it helps us to get familiar with our bodies so that when we're in stressful situations, we don't miss those initial indicators that we're having a stress response. Because a lot of times we don't notice that until we have a blistering headache, or until, our brain has gone numb or something like that. But if you can catch those initial signs, for some people, that's like those butterflies in your stomach. For other people, it's my face is getting really hot or it's turning red. And if you can kind of notice that, then maybe you can intervene earlier in the stress response cycle so that you can catch that stress and respond to it differently. And so one of the main takeaways with mindfulness-based stress reduction is helping people to learn how to be more intentional about how they relate to their stress rather than reactive habitually without really thinking it through. Because a lot of times when we react out of habit, we engage in behaviors that sometimes make our stress worse or exacerbate the pain that we're experiencing in the stressful situation.
Yes.
And so it's about how not to exacerbate that experience, but give yourself what you need and be kind and compassionate to yourself, and also not get caught up in a narrative about the stress. So a lot of times when a stressor starts to arise, we interpret it in a certain way, and we come up with the whole story about how it's going to turn out. And usually that's the worst case scenario.
Yes.
And we get caught up in that worst case scenario, which makes the stressful experience much more unpleasant for us. And so mindfulness gives you that opportunity to take a step back and really kind of ground yourself in your body, in your breath, and kind of recognize what your brain is giving you, and acknowledge that although your brain is giving you this fantastical story about the worst case scenario, that you don't have to necessarily buy that story. You don't have to attach to that. It's kind of like a car salesman trying to sell you, a lemon that's a car that's no good. You can listen to that car salesman, and then you can choose to not buy that car. And so I try to teach my clients the same thing with the thoughts that their brain gives them or the stories that their mind gives them. A possibility, but you get to choose whether you want to act as if that thought is true and follow through with that thought, or whether you want to kind of create a new narrative around your stress.
Do you, man, I could relate with so much of that. So when these people are having, and when we have these stressful instances come up and we start to feel, our body temperature rise, our face get red, or, start to get angry or nervous or anxious or whatever it is, and those narratives start running of the worst case scenario. So identifying thoughts as just thoughts and kind of reworking the narrative, do you also recommend just focusing on the breath, or because those narratives are so powerful and they're so consuming that it's very the prescription is easy to digest, but it's hard to apply.
Oh, yes. yes, that's what we say with in mindfulness circles. It's simple but not easy.
Mm-hmm. Yeah.
So yeah, because the breath is always there, and it sounds very simple just to breathe, but when you're in the midst, as you um so eloquently stated, it is hard when you're in the midst of that to really kind of connect with the breath. But yes, that is definitely something that we talk about, is how do you just take a moment out and just intentionally pause and connect with your breath. Because once you take yourself out of your brain and drop down into your body, that just creates space for you. Like that
Mm.
creates a moment of freedom. It creates calmness. It actually, your breath is a built-in um, a mechanism for you to calm down. It actually has physiological impacts on your
Mm-hmm.
brain, so that it starts to kick in your parasympathetic nervous system, which is the system that brings you back down to your baseline area of functioning. So it brings your breath to a calmer pace where you're no longer engaging in like shallow breathing or hyperventilating, but
Mm-hmm.
it brings that down, and it helps, just to cool you down and bring you to a place where you can look at the stressful situation from a more level-headed perspective, and
Mm-hmm.
again, engage in more intentional and thoughtful ways of responding to the stressor. So definitely I encourage people to connect with their breath. And really, I think with mindfulness helps you to see too is what's really going on now. Because when we get caught up in the stories, we start to respond as if the story is happening. But like
Mm-hmm.
if we can disconnect and say, wait, like what really is happening right now in this moment?
Yes.
So what
Yes.
really is happening right now in this moment is I'm anticipating what's going to happen. But if I can respond to what's real and true right now in this moment, then that has a totally different impact on my mood and on how I behave
Yes.
in response to this stressor.
Yeah. Yeah. You said focusing on what is real and true, and that is so important because
Mm-hmm.
the old cliche is the truth will set you free,
Oh,
right?
yeah.
And the
Yeah,
the opposite of that is that lies will keep you captive. So in these moments
exactly.
where we have all of this stress coming in and we're starting to fabricate these false narratives that are very extreme and
Mm-hmm.
are really hindering our ability to perform or communicate or whatever it is, these are lies, and that
Mm-hmm.
cliche says that those lies are going to keep us captive. And if we
Mm-hmm.
can start to identify those narratives as lies and then focus on the breath, kind of be able to get your focus back on what is true and real in the moment, then that is freedom. The truth will set you free. Start thinking about what's true and be free from that false narrative that's going to take you down the rabbit hole of doom.
Exactly, exactly. And another piece with mindfulness too that is really important is that non-judgmental piece. Like, in your experience, like kind of having this general acceptance of what will be right now. So if I'm feeling sad, mindfulness would invite me to kind of become curious about that sadness. Like, where do I
Mm,
feel that in my body, and what is this sadness coming to teach me? Because a lot of times we have categorized emotions as either positive or negative, and we want all the positive ones and we never want to experience the ones that we've labeled as negative. But all emotions kind of have their role, and they are teachers. They come to teach us or alert us to something that needs attention in our lives or in our bodies. And so mindfulness invites us not to push away our experience or to try to change it or try to make it be anything other than what it is. And so it cultivates this attitude of acceptance of our experience, knowing that our experience is different from moment to moment and it will change from moment to moment. So I don't have to, if I recognize that sadness is here right now and that's what I'm experiencing, I can actually approach that sadness in a gentle way rather than harshly pushing it away or trying
mm,
to make it different or make myself happy. But I can kind of explore what this sadness is showing me or what it has to teach me, and knowing that it's not going to last forever. So change is constantly happening in our experience. It's changing from moment to moment, and so I can be okay and accept that. Yes, I'm feeling sad right now, but that doesn't mean I'm gonna feel sad an hour from now. I don't know. Maybe I will, but maybe I won't, and I'll
mm-hmm.
just be open to whatever this experience has to show me, and be willing to be teachable.
Mm.
So a huge piece of it is not judging your experience and not trying to modify your experience to make it different, because that's another way that we turn pain into suffering. So we already have the emotional pain of sadness, which it doesn't necessarily feel good to be sad. But when we try to stuff the sadness, or when we try to ignore the sadness, or when we try to make it be different, then that's where we can exacerbate that pain and turn it into suffering.
Mm. So that non-judgmental piece, that's what really that comes down to, is not when you feel those feelings, it's not like, man, why am I sad? Stop being
Mm-hmm.
sad, man. Why are you
Yep.
sad? This isn't a situation to
Mm-hmm.
be sad. That is not the way to go
Mm-hmm.
about it. It's more so,
Exactly.
okay, I'm feeling sad right now, and just being curious about it.
Yeah, being curious. Okay, so where did this sadness arise from? Like, where am I? First of all, just like, where am I noticing it in my body? How do I know that I'm sad? What does this feel like?
Mm,
And then just exploring that, like, and it'll look different for everyone. So maybe my heart, I have a little heartache, or maybe this sadness is arising from a thought, a memory. Like maybe, yesterday I became aware of someone who passed away, and of course that that is going to bring about sadness. And
mm-hmm.
can I allow that sadness to do its work to remind me of the fact that I cared very deeply for this person that passed away?
Yeah.
And so it makes sense that I would feel sad. So a huge piece of when those emotions come is trying to kind of recognize that typically our emotions make sense if we kind of can look at where they're arising from, what the
Mm-hmm.
trigger is. They make sense. And so in that way, we don't have to feel this pressure to get rid of them or make them anything different than what they are, but allow itself to work through whatever that emotion is, and then kind of gain the wisdom from that. So like if I let myself work through the sadness of becoming aware of someone that I cared for being no longer here on earth with us, like then maybe I can come to a sense of gratitude for the time that I did share with that person,
Mm,
and then I can feel good about having allowed myself to experience that sadness because it was warranted. Sadness shows me that I actually care. And in the same way, when we feel anxious about certain things, or feel fearful about certain things, sometimes that anxiety comes because we care. Like, so if
mm-hmm.
I have to give a talk somewhere at a conference, like, of course I feel anxious before, but that is just showing me that I find this is an important thing for me to do. I want to do well at this. And so I don't have to try to not be anxious. But what I can do is respond to the anxiety by practicing, my talk, thinking through what I want to say, and then allowing that to kind of propel me into doing a good job. And so
Mm,
not seeing I think the message is not seeing our emotions as enemies, but seeing them as messengers, and as
mm.
opportunities to get to know ourselves on a deeper level.
Yeah. Yeah, that's so good. I just read a book by, are you familiar with Richard Rohr?
No, I'm not.
He's you would really appreciate him because I know you're a believer as well.
Mm-hmm.
And Richard Rohr is a Franciscan monk who has this nonprofit in Albuquerque, New Mexico called the Center of Action and Contemplation.
Oh.
He's super super wise. He's been on like Oprah's podcast, and he's very legit, and I highly recommend looking into it. Just hearing your experience and your profession and your practice and whatnot, you would really dig him. But I just read a book called Everything Belongs by him. He's a Christian mystic is what he is.
Mm.
And he had a quote in there that I was thinking about as you were talking that said, don't overcome your anxiety until you've learned what it's trying to teach you. And
Mm.
it's like that.
Mm-hmm.
It's. I mean, that whole time you were talking as well, it's like everything you were saying is truth. Like, of
Yep.
course you're going to be sad because someone died. That's truth. Of course you're going to be
Mm-hmm.
anxious because you have this big talk. That's truth. You want to perform well
Mm-hmm.
for these people. These are all
Mm-hmm.
true things.
Mm-hmm.
Yeah, so I definitely recommend checking him out. His last name is spelled Rohr, and he has a wonderful podcast out that's 13 episodes that goes through his new book. But he's legit.
Oh, awesome. Yeah,
Yeah.
I'll look that up. He sounds amazing.
Is there kind of a minimum effective dose that you prescribe to your clients as far as like mindfulness? Like, do you recommend like you need to do 15 minutes every day in the morning, 20 minutes, twice a day, whatever it is? Is there kind of a minimum effective dose that you've seen?
Yeah, the thing that I've found is that, with mindfulness, people have to find what works for them. So that's really what I encourage. The thing that I really focus on is consistency. So whether it's 5 minutes or 20 minutes a day, I just recommend consistency. So if you
Mm,
can find some time every day to just sit and be with the breath and calm your mind, drop out of your mind, drop into your body. That kind of builds muscle. I kind of likened it to if you're working out and trying to
yes.
build muscle, like you have to do it consistently to see the benefit over time. And so because a lot of times people will say, well, when I sit my mind just wanders or my mind won't be still, but that's actually, if you're aware of that,
Mm-hmm.
you're actually being mindful. Like you,
It's a
so that
bicep
it's
curl.
not about, yeah, so it's not about how still you can get your mind or how perfectly still you can sit, but rather it's about, are you paying attention? Are you awake right now? Are you noticing what's happening in
Mm-hmm.
this moment? And so the consistency really pays off, because what people find is that if they get themselves into a habit of finding some time every day to do this, it becomes they start to find that they are spending more time sitting, being able to pay attention to the breath, and less time with their mind wandering, because they've kind of started to make this a habit and get their body and their mind in the practice of meditating and of being mindful.
Mm-hmm.
And so then what you find then is, with that consistency, not only are your experiences of meditating more fruitful, as far as you finding that you're more and more mindful during those sits, but then you start to find that when you're not sitting, just in your life, that mindfulness kind of is more accessible to you, because you've developed it as kind of like a
Mm,
habit. You've cultivated that process of dropping into your body, connecting with your breath, and so you're able to more so kind of notice when your mind is kind of giving you these thoughts or trying to give you a narrative, and you're noticing that you're more intentional about the way that you're responding to that narrative.
yes, that's very well put. I think that
Mm-hmm.
with this wave of mindfulness and meditation and all these apps and covers of magazines, and it's a huge talking point right now that people dive into it expecting some like transcendent experience that,
Mm-hmm.
is almost like psychedelic and just
Right.
automatically just transforms their mind. But like you said, and I use that as analogy as well. It's an exercise, just like a bicep curl, just like squats, just like
Mm-hmm.
whatever it is, that you're just training your brain as a
Mm-hmm. Mm-hmm.
muscle to be able to have that ability to
Mm-hmm.
see things in that way. And the more you
Yep.
do it, the stronger it's going to get, like any
Exactly.
other exercise.
Mm-hmm.
Um, you just released a book called The Self-Care Prescription, subtitle Powerful Solutions to Manage Stress, Reduce Anxiety, and Increase Well-Being. And I saw it's doing awesome on Amazon, so congrats
Thank
on that.
you.
Without giving away your secret sauce in that book, what are some practical and simple self-care techniques that people can start to integrate into their lives that you think will have a significant impact?
Yeah, well, we just talked about one of the huge ones, the
Mm-hmm.
mindfulness practice, right? And so I think what goes along with that is just starting to create healthy habits for yourself. So cultivating time throughout your day where you are checking in with yourself and really getting to know yourself. I think self care is really about knowing what you need. that
Yes.
that requires that you know yourself and that you check in with yourself. So a huge piece of a self-care routine is coming up with a regular interval where you check in with yourself, whether that's like once weekly, you check in with yourself and see like, how am I doing? Like really, like not, the elevator speech that we give people when they ask how we're doing out in
Yes.
public and we just say fine, but like, how am I really doing, like emotionally, physically, socially, in my relationships? What am I in need of? And then the second part of knowing what you need is then having the courage and the willingness to give yourself what you most need, and recognizing that your needs will change throughout different phases of your life and as you kind of grow and develop. And so being willing to check in with yourself. So if you set aside that habit and make it a habit of checking in and saying, what do I need? And being willing to give yourself what you need, that's what's most important. And I think another piece that relates to that is really giving yourself the things that will promote long-term health and happiness. So a lot of times we, for lack of a better word, pacify ourselves sometimes by indulging in, things that make us feel good in the moment, but are not necessarily good for us in the long term. So self-care is not the same thing as overindulgence or, just, eating a whole tub of ice cream because I feel sad. But it's more about, okay, like what do I need in this moment? Maybe I need to sleep. So maybe self-care looks like, I got invited to this really cool event or party, but I haven't slept well all week. So self-care looks like turning that invitation down, unfortunately. And so self-care doesn't always feel good.
Yeah.
To like, sometimes self-care is just saying no, or self-care is asking for help when we value our independence and we, have this belief that we should be able to handle everything that we have on our plate by ourselves. Sometimes it's being willing to say like, I know I need help, and asking for that help and accepting the help. So I think the habit of checking in with yourself, seeing what you need, but then also being willing to give yourself those things that you need. And so the book is really unique in that it looks at 6 different domains of health and how you can take care of yourself better in those 6 different domains. So there's social self-care, which is all about your relationships, both romantic, family, friendships, and looking at how can you enhance those? How can you make them more fulfilling? How can you be the type of partner, the type of friend that you want to be? Then there's physical, which is all about movement, eating. Are you giving yourself the nurturants and the things that you need to be able to be here and be healthy and feel good in your body? Then there's emotional self-care, which is really all about mental health and how we relate to our emotions. There's mental self-care, which is more about keeping our minds sharp and really giving our minds extra substance so that they can stay sharp. A lot of times people start to notice as we age that our memories start to go, or that we're less engaged in that way. So really keeping your brain up to par and challenging it. Then there's the spiritual self-care, which I talk about a lot in the book, which is really all about how to nurture your spirit. First of all, is acknowledging and recognizing that you exist beyond the physical. And so knowing that, what are some of those soul longings that you have, and how can you give yourself what you need on a more spiritual level? And then the last domain is vocational. And so that's about your job, the work that you do in your life, the career that you have, and how do you take care of yourself in the midst of all of the demands that maybe your career places on you. And another piece with the vocational is also sometimes people find themselves in work situations that are less than optimal. Maybe you're at a job that you feel like is not really aligned with your purpose, or you're in a job that doesn't really align with your values. Maybe, you're being asked to do things that you just don't feel are right, but you have this dilemma because you need the job to be able to live and to pay your rent and to eat. And so how do you kind of make sense of that, and how do you cope in that situation and kind of take care of yourself despite your work situation not being optimal. So those are the 6 domains of self-care, and there's tons of activities, and I did it that way so that everyone hopefully in the world could pick up this book and find at least one thing that fits for them, one activity that fits for them. So maybe everything doesn't jive for you, but there's tons of activities, tons of questions to ask yourself, and also tons of strategies for you to try on and really see how it works for you in your life. And the way that I've set it up is that it's really for you to create your own unique self-care prescription that's going to fit for your life, for your demands that you have. And so in that way, it's more sustainable because it's definitely not a one-size-fit-all model.
Yeah. Yeah. Again, so much good stuff there. And just going back towards the beginning of that, the whole like checking in with yourself and knowing yourself. I recently recorded, I haven't released it yet, but a Ask Me Anything episode where I took questions from listeners and whatnot. And one of the questions was, what's one of the best pieces of advice that I've received? And I said I could give so many different responses to that because I love quotes. I'm a quotes guy, and I've had awesome conversations, but just like a very blanket piece of advice is the old Greek aphorism, know thyself. And being able to just to know thyself and being able to, like you said, take those 6 domains and customize them. There's no one size fits all, but know yourself, customize what you need to what you've identified in a real and truthful way. Don't try and fabricate something. Don't try and tell yourself you're something that you're not. It's okay to have goals and whatnot, but be real with yourself and what you need emotionally and spiritually and physically and socially and mentally and vocationally, and pursue those things with all your might. And
Exactly.
I mean, it's not selfish because it's going to enhance your relationships, it's going to enhance your life, and you're going to be a better person. It's you have to have the courage to just take it on and go full force that direction.
Definitely. And it will require, I think, another piece that relates to that. I love how you just put that, is that it will require you to prioritize. So we can't be all things to all people, and we can't do all the things, even though our society will try to encourage us to do all the things and to be perfect in every area of our lives. You can't do it all. And so that requires you to choose priorities, which I still am working on, like how to prioritize things so that I'm not, burnt out or not doing too much in one area, but totally neglecting another area of my life. So it's really important to create priorities, and that goes back to that quote you shared, is knowing thyself and really knowing, okay, what's most important to me in this moment, and then being willing to maybe let go of some other things in the service of like your health and wellness.
So we're both believers. How do you nurture your spiritual needs?
Yes. So for me, it looks like daily meditation and prayer, really connecting with myself, connecting with God. It looks like reading my Bible every day, whether it's, a day that I'm, sitting out, actually writing in my journal, my prayer journal, or whether it's actually just opening up the Bible app on my phone and looking at the verse of the day. Like different days call for different things, but really connecting with the word, connecting with God in prayer. And then also worship music. I love listening to worship music, and that just really uplifts my spirit in a way that nothing else really can. And I find listening to worship music, but then also releasing all of the questions that I have, the challenges that I have, the uncertainties, the anxieties to God in prayer, really just gives a freedom and a peace that nothing else really can give. So that is really important for me with regard to nurturing my spirit, as well as, I said, meditation, which helps me to kind of get grounded in who I am and what's important to me, and then really know myself so that I can give myself the things that I need.
You spoke pretty much my exact experience as well with
Mm-hmm.
nurturing my spiritual
Yeah.
needs. I mean, I'm huge with mindfulness and meditation and with the Bible app, and I have a prayer journal as well
Mm-hmm.
where I will write out prayers, and I oftentimes, as many of my listeners know, will be in my daughter's room with my Bose headphones on, just jamming out to some worship music, and
Yes.
just the feeling that I get from it. Music connects to most people in a very profound way, like the sense
Mm-hmm.
of nostalgia it can bring up and memories, and just the power that it has is pretty ineffable. And I feel like
Mm-hmm.
that is part of when I'm in there, and I've shared this before, but when I'm in my daughter's room, when I have my headphones on, when I'm listening to a jam that I really connect with and that is really
Mm-hmm.
speaking truth, the I get these feelings of chills and
Yeah.
euphoria and excitement, and I feel like that's the
Mm-hmm.
Holy Spirit
Yep.
within me, just like, yes, this is good, this is right, this is,
Mm-hmm.
your true and proper worship, as the Bible says. And
Oh yeah.
um yeah, it's powerful, it's super powerful. I love that. uh,
Yeah.
so
Definitely.
I have some rapid fire questions for you, just to wrap it up, if that's all
Okay.
right.
Yeah.
But if you could tweet one thing and it was guaranteed to be seen by the entire world, what would it say?
Yes. Oh, I've been thinking about this one. It's a big one.
Know
But I
thyself.
think yeah, that would be a big one. Know thyself. But maybe what I would say with regard to self care is not selfish.
Good.
Yeah.
Yes, that's good. I'm a high school technology teacher, and I try
Mm-hmm.
my best to integrate real life and real world concepts and into my curriculum that are not really involved with technology at all, just so I can help my students be better prepared for life. What do you think are some things I should be communicating to the youth to help better prepare them?
For their
Just for
potential.
life in general, just for
Mm-hmm.
happiness and well-being. And this could just be one thing, two things, whatever you think. What do you think I should be doing as a teacher to help better prepare our youth to just have a better life?
Yeah, I mean, I think fostering creativity and individuality. I think a lot
Mm,
of times, if I think back to high school and college, a lot of what I was thinking how the world works was that there were certain like formulas or just very rigid pathways that I had to go down in order to
yes.
be a successful adult. And so
Mm-hmm.
I find that there are many pathways to success, and that you don't have to do what all of your other peers are doing in order to be successful. So to really kind of again along that line of knowing yourself, being okay with being different
Mm-hmm.
and having unique interest and knowing that there are various ways or various pathways to get to the same destination, and that you don't
Yes.
always have to do what everyone else is doing or feel stifled by just one particular career path that maybe a professor is pushing on you or a teacher is telling you you're good at.
Mm-hmm.
That doesn't necessarily mean that that's what you're passionate about. And
Mm-hmm.
it's okay to be good at things but not love them, and to really pursue what's going to make you happy, because life is short.
That's right. That's right. So good. All right. So 3 books and why. What are 3 books from any genre, other than your own, because everyone's already going to buy that book, that you would recommend to someone, and why?
Yes. So the first book that I would recommend, this is one that I read a couple of years ago, I guess now, that just really lit a fire under me, is by Jen Cicero. You Are a Badass.
Mm-hmm.
And so excuse for the language,
My
but
wife
it
has that
is
in her
yes.
nightstand right now.
It is amazing. So it just really speaks to um just how much you are capable of doing in your life, and not putting limits on yourself, and really looking at yourself from a perspective of you being capable, you being worthy of all of the dreams and all of the aspirations that you have for your life. So I love that one.
Mm-hmm.
And then there is, I guess, a second one that I would recommend is by Priscilla Schreier, and it's called Breathe. And that one is huge because it's all about how to create margin in our lives. And so I think we definitely need this one as a society because we're always being reinforced for accomplishing and getting things done and being productive. But it is from a biblical perspective, and it talks about how Jesus, when he was here, observed the Sabbath, and he
Yeah.
he took rest from his work, and how it's so important for us to do that presently so that we can be refreshed and recharged and rejuvenated to be able to fully walk into the purpose that God has for us, and that we don't have to kind of get sucked up in this mindset that I have to be just going all the time. So that's really important. And I guess the third one, like I would say, is the Bible. Like, I mean, there's so many gems
Yes.
in the Bible, and so many, I think, things that speak to every situation that you can find yourself in life. I think there's just something so profound about knowing that when Jesus was here on earth, he was tempted in every way. He is able to sympathize with everything that we've experienced. And so opening up the Bible, seeing those truths and really believing that, and getting your faith restored in that way by reading those truths and really believing that and speaking those verses over your life and over your situations that you find yourself in. I think so that is a endless fountain of gems that I would say. Yeah.
So good. Amen. Robyn, thank you so much for doing this. This was wonderful. I can't wait to read your book and keep following you on social media and stuff. Where can people find you online?
Yes, so I am on Instagram at Dr. Robyn Gobin. I'm also on Facebook, the same name, Dr. Robyn Gobin. I'm on LinkedIn, same thing, Dr. Robyn Gobin. And then my website is another place that people can reach out to me. It's www.robingobin.com. If people want to grab my book, The Self-Care Prescription, it's currently available on Amazon. And if you want to know more about the book, there's a website for the book as well, www.selfcareprescriptions with the S at the end.com. So that is great. And then one last thing, I will be in Atlanta. So for people who live in Atlanta who are listening, I will be there for a book signing event and a free mental health / self-care workshop. And that's going to be on Saturday, September 28th at the Boulder Crest Church of Christ. It's going to be from 9 a.m. to noon. Again, that's Saturday, September 28th. So I will send you information about that so you can feel free to share it. I'll post it all over my social media too as the time gets closer. It'll be an event that you'll have to RSVP for through Eventbrite, but again, it'll be free. So that's the way that people, if they have their book, they want to come hear me talk about it in more detail and also get their book signed. That's an opportunity to be aware of.
Awesome. I'll put all that stuff in the show notes as well. Thank you again, Robyn. This was great.
Thank you so much for having me. It was a treat.
A special thanks to King's Kaleidoscope for the instrumental used on the intro and outro of this podcast. Also, a big thanks to the good people at Capitol Floats, which is Northern California's premier sensory deprivation and float tank facility. I am a frequent user there, and the experience is transformative to say the least. And for listeners of this podcast, they are offering an exclusive deal of 40% off the normal price for a single float. Just go to capitalfloats.com and use the promo code LifeEnchanted with no spaces at checkout. If you're in Northern California, you definitely want to take advantage of this. Please remember that I am not a doctor, so definitely consult your physician before making any sudden diet, supplement, or lifestyle changes suggested in any of these episodes. If you're interested in connecting with me, you can send an email to nick, N-I-C-K, at mylifeenchanted.com, or you can find me on Instagram at mylifeenchanted. Peace.